My daughter and her husband, they serve in the Air Force, so I'm a military mom too. So that's my introduction. We'll go to the next. I welcome you to the session. I don't know how welcoming the session has been, but there are some good things. We hear a lot about the bad, and there is a lot going on right now. So hopefully, I've pulled out some of the bills. And I'm going to give you some kind of tips from my end that I think will be most helpful for you as you try to navigate through this session and try to follow what is happening. So I don't know if anybody ever remembers this. I'm Just a Bill and all the Schoolhouse Rock. I kind of grew up on those, and I love them, and that's part of the reason why I got into politics is watching those cartoons. I've been wanting to be in politics my whole life. I actually wanted to be an attorney, but motherhood kind of came in the way of that. So I'm going to go through some House joint memorials first. There are a few. The first one is the House Joint Memorial that passed was just urging Secretary Kennedy to remove artificial sweeteners from school lunches. The next one was to honor its commitment to fund fully the portion of the Individuals with Disabilities Act at the promised 40%, and that passed. They wanted to repeal the Blaine Amendment and put it on the ballot for repeal. That failed. And then they have one that would strike the language that would compel children to attend public schools in the state and would insert language to a right to educate children outside of public education. And right now that's in the Education Committee. So just so you know, these House Joint Resolutions and House Joint Memorials are not laws. They're not anything that anyone really needs to follow. But the reason why you should pay attention to these, other than the joint memorials are usually directed at Congress, the joint resolutions kind of set things up, set the stage for what may happen in the next legislative session. So with the House Joint Resolution 9, they're probably going to be looking at doing some language that would not, that would make it so that children didn't have to attend public schools and they could be educated outside of a public kind of education system. So just watch for that. So we're going to go straight into some bills. So Senator Wintrow and Representative, I'm thinking of his first name, but I can't think of his last name right now. But Senator Wintrow brought forth this bill that would have directed the Department of Health and Welfare to study other options for Medicaid programs that would help individuals specifically that were on the Medicaid Right to Work programs, which allow them to make a little more than usually the cap that they have to be to be able to get Medicaid. This asked that the legislature would have the health and welfare kind of study what they could do to bridge that gap when individuals turn 65 and they want to continue working and they're just pulled abruptly off that program. What they could do to kind of put a bridge in between those. That would have that would have influenced the structures for eligibility, home and community-based services. It would have helped keep people from being institutionalized, which on the long run would save the state money. And so, and as we know, most people don't want to live in an institution if they can keep from doing that. It's expensive, and it's actually better for the longevity for individuals to live with their families, friends, caregivers that they know. So this bill was not given a chance to be printed. So for those of you that may not know, there's when you first introduce a bill, you have to ask the committee to print the bill, that there's enough merit with the bill that it can be printed. And then after it's printed, it has a public hearing, and that's where we come and testify. And then if it passes that, it goes to the floor of whatever chamber to be voted on. So Senator Wintrow had asked the committee to print the bill. There was some really good testimony, heartwarming, heartbreaking testimony by individuals that are in the middle of these programs that have been abruptly taken off, and the committee still voted to not print the bill, so it's sitting in committee. Excuse me? Did somebody have a question? Okay, sorry. That said, this bill I think is very important. And Senator Wintrow and Representative Wheeler, so Democrat and Republican, I have been really pushing for this. We can ask that the chair of the Senate Health and Welfare Committee bring this bill back up. So don't feel like if a bill is still held in committee that it's dead. Sometimes it is. But I think this bill, if we put enough pressure on the chair, this bill can be brought back up. And I think it's a very important bill. I think it brings some good data. It could facilitate conversations, bring some good data that we can bring back to the legislature and say, okay, we need to have a bridge program in the next session. So it would give us some time between now and next January to get that all built up so that we can figure out what we can do to help individuals that fall in that. So S1267, I know everyone's going to get these slides, but just remember on this bill, this is something that I would urge you to push, send letters on. It will help quite a few in our state. Okay, so the next is House Bill 494. It already passed the House. It's in the Senate, and then it passed the Senate Health and Welfare Committee, and it's on the Senate floor in the 14th order, which is called the amending order. This bill would revise background checks requirements through the Department of Health and Welfare. It'll affect, so there will be effects to home care agency, personal care workers, Medicaid waiver providers, and family caregiver hiring pipelines. So there will be new requirements. So you will have to make sure that if this bill passes, that you check those. So you're going to want to watch. There may be some increased administrative burden on small providers. So you would be looking at just changing how you do those background checks. So, and there may be some delays in onboarding new workers. And this will be especially critical in our rural areas of the state. So just watch this bill. It's towards the end. I know they're amending certain things in it that they thought were issues that the House probably should have found. But just watch on it. Watch for this one. The next one is House Bill 527. This is the Idaho Yellow Dot program. I don't know if many people know about the Yellow Dot program. It's in the House Health and Welfare Committee right now. And this bill would repeal this program. And AARP is against this. What the bill is, what the Yellow Dot program is, if you're not aware, you can go on to Health and Welfare, and they will and ask for a Yellow Dot packet. The packet comes and it's literally a yellow envelope, and then you get a sticker that says Idaho Yellow Dot Program, and it's got a little picture of Idaho in the middle that you put on the back of your car. you put all of your medical information or the person that you're caregiving for medical information. So in my case, I had the medical information. I was part of this program. I had the medical information for my mother and my father in my car. So if we were to get in a car accident, um, and I was not able to tell them anything about my dad or my mom if they were in the car with me, that would indicate to first responders that there was medical information in the glove compartment of the car, or somewhere in the car they would find. So if this bill is repealed, that program would go away. And it's a very simple life-saving tool for Idahoans. And I think it's very important for individuals that are caregiving right now. It could cause delays in emergency response. I know in my case, there are medications that I'm allergic to, and some of those are pain medications. So if I were to be in a car accident and they were to give me one of those pain medications and they didn't know, if they didn't know that I had that allergy, that could cause some critical life, possible, life emergencies. So I I would urge you to, if you think this program is valuable to what you do, to urge that House Health and Welfare Committee to not hear it. I know if it does go to the Senate side, the chairman of the House Health and Welfare Committee has indicated to me that she will do all she can to not let it have a hearing. But right now, just be aware of this bill. So this is another one. This is House Bill 614, and it involves involuntary commitment. So this bill would expand the criteria for involuntary commitment. And for those that are aware, there was an involuntary commitment for neurocognitive disorders that passed. Not last year, but the year before. I believe it was in the 2024 legislative session. This bill would expand that bill. It would change who could be involuntary committed by allowing other conditions that were previously excluded. And it would change the definition of mental illness to include people with neurocognitive disorders. So I would urge you to keep an eye on this. Whenever we're talking about involuntary commitment, it's always a very tricky line to walk between not taking too many rights away from individuals. So watch this bill. It's in House Student Rules right now. I anticipate if it gets a hearing, there will be a lot of revisions to the bill, but I would urge you to read through the bill and just keep an eye on it. All right, so I like to do a couple of trivia breaks. Um, so I don't know if anyone knows who the longest serving president was. Any indication? And just yell it out. You can take off mute. I don't think there's so many of us that. Anyone have an idea?
Roosevelt.
Bunch of answers in the chat.
Yep. It was Roosevelt. He was the longest serving president. He served for 12 years and I believe 38 days or 39 days. Longest serving president. It was shortly after that they put in limits on how long the president could serve. So yeah, Roosevelt was our longest serving president. All right, so on to one that's been in the news a lot, which is our tax conformity bill, which was House Bill 559. This bill put tax provisions in line with the one big beautiful bill that was approved by Congress. Idaho had the opportunity to accept all, some, or none of the tax provisions. That was their right. They decided to accept them all. Because of this, and I'm not going to read through all of this, but there are different tax provisions that deal with how your deductions for tips over time. There's a deduction for seniors. I believe, though, that the deduction for seniors, it's 6,000 per individual in the household. That meets that criteria. However, if you are a very low income senior that does not need to file taxes, it's not a refundable deduction. So you're not going to get that $6,000 back. So this helps seniors that are more in that area where they either have to pay taxes, they end up paying taxes, or they're going to be, they're going to be that. Yeah, that's basically it. If they have to pay taxes, this will reduce the amount they have to pay. And as it's not a refundable tax credit, it doesn't have much more benefit than that. There are a lot of business-related tax provisions. Most of the tax provisions that affect individuals are only for a 4-year period, and that's why they put those tax conformities into effect this year instead of doing it for next year, which was the push. The tax provisions for businesses and corporations are in perpetuity, so they do not end, but the tax provisions for individuals do end after 4 years unless they are extended. That said, we already came into the legislative session in a deficit, and the legislature has, as you know, has been going through and slashing budgets even more than they did last year when they asked all state agencies to reduce their budgets by 3%, and they reduced provider payments by 4%. They've now added on 1 and 2% decreases to state agencies. They have said that they are not going to touch Medicaid and schools, and I believe corrections. But they have not finished with their negotiations on the budget yet. So conforming to the tax bill is going to cost minimum 155 million, and in 26 and 175 next year. But many of the indications across the United States it looks like it may be double that amount this year and next year, which will have a significant impact on our budget. So as you are watching the legislature do their negotiations in the Joint Finance and Appropriations Committee, these are things you need to keep in mind. The legislature is going to and has been cutting other programs so that they can meet these tax conformities that they passed in order to make sure we still have a balanced budget, which we have to have constitutionally in our state. So watch what they're doing in JFAC. Some of the conversations they have there have been very heated, and I would urge you to keep an eye on that and in contact with your legislators and make sure that your voice is heard as they are working through these budgets. They need to hear from individuals. So this is a big one that we are hearing in our state right now. And I've attended many meetings about this, and no one is really on the same page. So when we're looking at what the legislature is talking about and what the executive branch, the governor and lieutenant governor would like to do. They're not the same right now. So keep an eye on what they're doing with the budget. It will have real life impacts on what you are doing right now and moving forward in what's available in the Medicaid programs. Things like home and community services are not mandatory for us to continue receiving funding for Medicaid. It's programming that the state has decided to that was decided was important for individuals in our state, and it could be something that could be cut or cut more than what they've already done. So keep an eye on what they're doing there. I would urge you, this is really important. Of all the things going on, this one is very important. They are House Bill 701 is a rental application fee bill. It's moving through the House. There's going to be a hearing in the House Business Committee. It would create consumer protections. It's actually a really good bill. It has protection in place for renters, limiting application fees, ensuring that their fees are tied to actual screening costs. We're seeing an uptick in rental agencies accepting application fees and not really, just taking as many application fees as they can and not really running any screening of those from those applicants, just keeping the fees. So there's a lot of fraud that's been going on, not in all landlords, but this will help with that. So it'll improve options for low to moderate income individuals is the hope. It'll limit repeated application fees as well. So if this is something that's important to you, that has affected you as you've been moving through this journey of life, contact your legislators, letting them know that you support it. And then if it does pass through both chambers, I would urge you to contact the governor's office to sign it into law. The next one, this is a bill that I myself have been working on with our House sponsors. It's a bill that we have been actually working on for 5 years now, and we are finally there. This bill, what the bill does, one, it brings all the guardian and conservatorship statutes for the DD sections of Idaho state statutes concerning this all together. So all the guardianship and conservatorship statutes are in one area. So whether you're talking about adults or children, it's all there where it was split up prior. The bill also promotes a more kind of person-centered planning when they're looking at this. So what we have put in the bill is that judges and courts have to consider less restrictive options before they go to a full guardianship and conservatorship. So they can say the court can say that this individual, and this would have been very helpful with my father as he went down his journey with Alzheimer's. There are points where they don't need a full guardianship. So the courts can say you can have an informed decision maker. So I could have been my father's informed decision maker, and I could help him kind of navigate those instances in his life where he needed help before going to a full guardianship and conservatorship. So it gives different options for the courts to have prior to getting to a full GNC. It also guarantees visitation and communication with family and friends for a person that's under a guardianship and conservatorship, which was not in statute before. So I would urge you to kind of follow this bill. It's already passed the Senate, and it's in the House. We have made sure that we have brought in the DD community and have their support, the courts, We have brought in the counties, the cities. We have brought in prosecuting attorneys, defense attorneys. We've brought in everyone we can think of to look at this bill over the last 5 years, and we have a good bill. Is it perfect? Probably not. No bill is perfect, but this is a really good bill. It's a long bill. It's 120 plus pages, but it is a good bill. So it is going to impact caregivers that serve as legal guardians. So you may see a few changes in how roles are defined, and there are going to be some different enforcement provisions. So you're going to want to make sure to take care and look at those. And care planning may be affected as well. But I think you will see some good outcomes from this. I think this is something that is going to be good for everyone that either lives with or caregives for somebody that is in this situation. So keep an eye on that one. All right, so I didn't make slides for every one of these, and I probably missed a few. There are a lot of bills right now dealing with foster care, child safety, and residential care and children. There's so many. This is just a few. So 1239 extends existing sex offender residency restrictions. This is a good bill. So it's already passed the Senate. It's in the House Student Rules. So you'll want to keep an eye on that one. 1266 deals with expedited placement eligibility, so that they can be given to a trusted kin, so that the goal is to stabilize vulnerable children. And there's also some technical corrections in there. So you want to keep an eye on that one. 1288 puts together and creates a funding mechanism and a fund for special education expenses for Idaho schools. So it would expand the amount of money that was poured into our Idaho school system for special education programs. So keep an eye on that one. 1292 deals with licensure training requirements for foster care. So to receive your foster care license, they have ticked up the training requirements. So you're going to want to watch that one. 529, House Bill 529 deals with child custody interference. It just updates those statutes. There's just some small updates, but you want to look at that. House Bill 558. What this does is make sure that foster youth continue to receive their federal benefits, and that those federal benefits are put aside in a separate account that is for them alone. So you're going to want to watch that one as well if you have foster children in your home. House Bill 574 removes all immunization mandate language from schools and daycares. That kind of follows along with what's happening at the federal level. So watch that bill, especially with the uptick in the amount of measles cases we have going through the United States. This is particularly important. House Bill 680 amends the statute regarding interviews with child abuse victims. So you're going to want to watch that one as well. It talks about when the interviews can be taped, either by just by voice alone or by video. So watch that bill. House Bill 682 updates the termination of parental rights language. It kind of strengthens that and what needs to be met before that happens. So you want to watch that one. House Bill 691 updates the definition of neglect in regard to foster care children in general. So you'll want to watch that one. I think it's a pretty good bill. And then House Bill 692 deals with child protection hearings. It amends who's allowed in the courtroom during the hearing. So you want to watch that bill as well. I have heard there's a couple of bills that are coming that would require new requirements for oversight and inspection of children in residential care, and that would create a youth bill of rights for young people in residential care. They don't have a bill number yet as far as last night, so just keep an eye on out for those. All in all, I probably missed a few bills, but there are a lot of bills dealing with kids right now. Kids in residential care, kids in daycare, child safety, kids in foster care. So watch for those bills if that's something that's important to you, or if you are a caregiver or a foster care provider for children and youth. Um, Trivia break really quick. Does anyone know who the shortest serving president was? What did you say? Did you say Harrison?
Yes.
If you said Harrison, you're right. He served an entire month. 1 month. Yep, not too long. Just enough to celebrate, probably for 2 weeks, and yeah, he didn't serve for very long. So 1 month he was in office.
Who was that voice
Now,
that
who said
answered?
that?
And he gave a 3 hour talk out in the cold in a storm, and he got sick, and that's what took him.
That's exactly right. I love it when there's other policy wonks on the calls. All right, so I'm going to try to go through these quick. I'm sorry I talk a lot. There's so much going on. There's legacy reform pressures right now, as you know, the work requirements, the transition to managed care, which I'll talk about a little more here in a minute. The Medicaid work requirements come into effect next January. So just keep an eye on that. I anticipate they may be looking at more changes in Medicaid eligibility requirements. So you're going to want to watch potential cuts to Medicaid services. As I kind of hit on a little bit, there's maybe possible cuts to home and community-based services, therapy, case management. We already know that they have cut mental health services. And we know some of the tragic things that's happened over the past 3 months from that. So keep an eye on all of that. This has real life on the ground effects for everyone. You're going to want to look at we already know Medicaid Family and Personal Care Service program changes that was ended. I'm hoping that at some point in time there might be some future legislation or rule changes in that regard. SNAP restrictions went in place on the 15th, banning candy and soda, and they're a little wonky, so make sure you read those. There are some things that qualify for as candy that I don't think are candy, and there are other things that are fine to buy that I look at and think, well, this is candy to me. So keep an eye on those restrictions. They're different. I've noticed some of the grocery stores are putting them up so that they're there, but I know Health and Welfare has that on their website as well. And the SNAP work requirement changes went into effect on the 1st of February. So keep an eye on all of these areas because they tend to change, especially now right in the middle of session. Okay, the Medicaid system changes. As you know, we're going to a managed care implementation. This was last year's bill, House Bill 345. There are listening sessions going on that start next month. You will get these slides, so you can click on that link I have below and you can find one that's near you, or You can also put in your comments directly to Health and Welfare as they go through this. But this is very important because how they structure managed care will affect access, what provider networks are available, what support services are there. So be really diligent in watching this if this affects you. And I urge you to just get in the middle of it and let them hear what's important to you as they look at what the managed care structure is going to be. So this is happening right now. Next month they start them. They're not. I think they only have 5 listening sessions. So make sure that you're part of one of those, or that you at least submit some testimony. So as we talked about, Health and Welfare and JFAC is the Joint Finance and Appropriations Committee. There are a lot of bills that will impact caregivers that emerge late. So they are introducing them, and they will introduce them through the whole session, and they move fast. Last session, they tried to push through Medicaid expansion repeal bills without even having public hearings until they heard back from people that were angry about that. So these bills move fast. They come in late, especially bills that deal with what we're concerned with: Medicaid, long-term care, disability, behavior health, licensing and workforce rules, and rural health care. So make sure you are watching those bills as they are coming up and they're going through, and I'm going to show you how to do that towards the end here. Okay, so core policy areas to watch every week. I watch these daily, probably 20 times a day. But you're going to want to track these issues. And so rather than track individual bill numbers, which you can do as well, I like to look at issue categories. And these are usually where caregiver impacts are more seen, or they're embedded in larger funding or structural bills. So anything that deals with Medicaid eligibility and coverage rules, so changes to waiver requirements, work or reporting requirements, redetermination, exemptions, you're going to want to watch that. Those are usually in the House and Senate Health and Welfare Committees, but we are after the time when bills can be introduced, so they will probably be in the Ways and Means Committees. So keep an eye on those bills, and keep an eye on anything to do in that category. Home and community-based services funding and definitions. So you're going to want to watch how they define home health aides, respite care supports, personal care supports, case management, rural health care. So you're going to want to watch all of that. So make sure that you're watching what they're funding, how they're defining it, because sometimes they define them differently so that that gets funded at a less by defining it different. They do things like that. So make sure you watch it. So I call those invisible cuts when they change the definition of what a home health aide is, so that it excludes a lot of people that are able to get paid under the previous definition. So make sure you watch the definitions as well. Workforce and provider support rules. So you're going to want to watch for licensing requirements like background checks, provider reimbursement, direct care workforce incentives. So look at that and how they're funding those. Direct care workforce incentives, we're talking about anywhere from, giving funding to pay back student loans for individuals that go into nursing or physician programs, or become a direct care worker. So you're going to want to look at that. And the Medicaid budgets, you're going to want to look at the appropriations for the Department of Health and Welfare. Look at riders and earmarks that they do that will reduce or expand Medicaid services. Especially in this year where we're having some budget decisions that are mostly shrinking the budget in these service areas, you're going to want to keep an eye on it. All right, so I'm a big proponent of using our stories for advocacy. I'll go through this quickly. Advocacy, as we know, it's an individual or group that try to influence decisions by our elected officials, and it can be anyone. And our stories are really impactful because they bridge that gap and connect us to other people, and especially to our legislators. If they hear our story, you heard my story at the beginning of this session. That bridged the gap between us. You know something about me, and the next time I see you, you're going to remember my story about my mother and my father. And that's what we try to do with our advocacy stories, is bridge that gap. So use your stories. And by using your stories and your experience and your shared experience with the people that you caregive for, it can remove those systemic barriers that are there. It can improve our laws. It can make sure that our priorities are heard. Can engage our communities. We're together here as the Idaho Caregiver Alliance, and we're a community of individuals that have a shared experience. And it can lift our voices as a shared community, and it can lift your individual voices. And the hope is that it improves our lives, improves the lives of our loved ones, improves the lives of our neighbors. And again, it creates those personal connections. So that's what you want to do. And no one is more of an expert on the issues that you're facing, that you see in your life, than you. You are the expert. You have that experience, and you have that voice. And make sure your voice is heard. So some things you can do: attend town halls, attend committee meetings. You can testify in person or remotely or in writing, emails, writing, letter writing campaigns. You can engage the media. They love human interest stories. You can do letters to the editor, opinion pieces, interviews. You can set meetings with your legislators, build those relationships. Those are all things I would say to do. So we have 35 legislative districts. I'm going to go through this fast. We know that we're very Republican. This is what our state looks like. We have more female than male in our state. And as you can see, 62% of our state is Republican. This is the Idaho State Legislature website. So this is the most important place that you are going to go, the landing page for you to find all the bills, how to contact your legislators. It is here. You can find the committees, you can find your legislators, you can find information for where the bills are and what the bill number is. So this is where you go to find your legislators' information on that page. You can find who's my legislator here or contact my legislator. Either one of those works. This is where you can find committee. So if you wanted to find the Senate Health and Welfare Committee, you're going to click there. And we have Senate, we have House, and the joint standing committees are the committees like the Joint Finance and Appropriations Committee that I've talked a lot about today, that you're going to want to follow, especially if we're talking about our Medicaid budgets. So that is my last slide. I've gone pretty quick through that. And I am going to ask if anyone has any questions at this point. I'm
Lisa,
sorry, I really
was-
tried to get through everything.
there were quite a few questions in the chat.
Okay.
One thing that I kind of maybe might condense a few of the questions altogether is any of the bills you mentioned, how might they impact certified family homes? If you know, like, is there any talk about any cuts to certified family homes, or what do you know about the impact that any of these bills that you talked about today might have on certified family homes specifically?
Yeah, so there'll be a couple of impacts. So when we're talking about funding, they have been talking about funding for that. So those have been in part of the Joint Finance and Appropriations Committee's funding topics. So right now, there are no talks to cut funding to that program that I'm aware of. but they are not done with those talks, and that has come up. The other area would be in either the changes to the guardianship and conservatorship statutes that are coming up, or if in your certified family home you have children, you're going to want to watch those bills, that whole array of bills that may affect the kids, or what you have to do to for those children in those homes. So just keep an eye on that. And yeah, as Sarah said, if you have questions, please reach out to me. I'm happy to answer any questions that I can.
Yeah, Lisa, I'm really glad you caveated that with if you can. You are doing an amazing job of tracking and keeping abreast of what's going on. But I think in terms of uh, understanding the intent or where things may turn is really kind of beyond the scope of any of us. And but so thank you for the information you provided here today. Very, very valuable.
Absolutely. And please, if you have any questions, or if there's something that's affecting you that I can share your story with the legislator, I am happy to do that. I'm absolutely happy to do that. I talk to them every day, multiple times a day. And the stories any stories I can share with them that are from Idahoans are very impactful. So, and I apologize, I was not able to put everything going on. There is a lot. When I say there's a lot, there's so much. But please, keep an eye on, especially those that impact your life. Keep an eye on those bills that are going through. But I would, for everyone, you should be following the Joint Finance and Appropriations Committee right now. Those are huge impacts. So, all right. Thank you so much for allowing me to be here, Sarah, and everyone on the call. Please reach out to me if you lose that contact information. Please reach out to Sarah. Somebody can get you in contact with me. And don't press exit when you leave. Just press leave the breakout room. I've been told to tell you that.
Thank you, Lisa.
All right.
Fabulous.
You guys,
Everyone, just stay caffeinated, I say, through this legislative session. I've been telling people Jack Daniels is my best friend in the evenings, but drink a lot of coffee and be an advocate. Advocate for yourself, your neighbors, and for your loved ones. They need to hear you.
thank you again, Lisa. And if you guys don't want to put yourself back in the main break room,